Many patients confuse the bulge that comes with the hernia with the hernia itself. So a hernia is just a hole in the strong tissue that holds our intestines inside our abdominal wall. It can happen anywhere from the chest down to the groin. Risk factors for hernias include being overweight, lifting heavy objects, being male, being a smoker, and having diabetes.
The reality is that a hernia is an opening that's through all layers of the muscles of the abdominal wall. So the bulge that patients can see is the stuff that should be inside the abdomen poking out through that opening. So the treatment is not to cut anything out, but to bring those muscles back together. And so not only do we want to bring the muscles back together, but we want to do something to reinforce and strengthen that area. And that typically is to place mesh.
So this is why I think it's so fascinating about hernias. They're so common that many people think that they're easy to fix. The truth is that hernias are just like any surgical problem, and they demand a thoughtful, careful approach before, during, and after surgery. This is to really give patients the best chance of a successful procedure. I tell my patients that football coaches don't just let their players walk onto the field and expect them to win games. Success demands preparation. So before every hernia operation, I prepare my patients for the best chance of success. This may mean weight loss, it may mean quitting smoking, or it may mean diabetes control. These are the things that can decrease the chance that a hernia will come back.
The number one reason that patients get hernias is because of an incision. And so when we think about fixing a hernia, especially if it's an incisional hernia, we need to do something different than what was done the first time around. And so what we do differently is really two different things. We first want to optimize our patients. So we want to make sure that all of their risk factors for getting a hernia that can be modified are modified. So we often will ask our patients to lose weight, to stop smoking, and other things that put them at higher risk, get their diabetes under good control so that the risk of infection is lower. And then we want to go in and make sure that we give them a repair that is tension-free and that we use something to reinforce that repair.
In every clinic that I have, a patient always brings this point up about a lawsuit they've seen on TV or one of their friends or relatives having a complication from mesh. While it is true that mesh can cause some of these complications, we do take great care to avoid these complications. How we do this is we hide the mesh in a layer of the abdominal wall so that it does not come in contact with the bowel or any of the structures in the abdomen. And in most of these cases that you see on TV, the mesh has eroded into a structure like the bladder or the bowel or colon, stomach, those types of structures. By putting this in between layers of the abdominal wall, it prevents the mesh from causing these complications. We don't use any sort of special mesh at UAB, any different from what is done at other places. It's just the location of how we place this mesh that helps us prevent complications from mesh. That being said, mesh is important to use in a hernia repair because it reduces the risk of recurrence from 60 to 90% without mesh to under 10% with the use of mesh.
Hernias can absolutely come back. Depending upon the size of the hernia, the location of the hernia, and many other factors, the risk of your hernia coming back can range from 1 to 40%. When hernias do come back, they become even more difficult to fix and require a specialized, thoughtful approach. Because of this, we want your hernia surgery to be successful the first time around, and we feel like it is important for patients to receive their hernia care at specialized centers with high volume hernia surgeons. Groin hernias are generally low-risk procedures. However, they can have complications. One of the most feared complications from an inguinal hernia or groin hernia surgery is chronic pain. Chronic pain is defined as pain that lasts longer than 3 months, and the complications of living with chronic groin pain can be devastating. Sometimes that pain is even worse than the pain that patients had prior to surgery. There are many ways to treat chronic groin pain, and luckily, the chance of getting chronic groin pain after an inguinal or groin hernia surgery is very low, around 6%. When it does happen, it can be very challenging to manage. We have experts in chronic groin pain that can help us manage this, but also we firmly believe that getting an excellent hernia repair the first time around is essential to preventing it from ever happening in the first place.